It's great to be here today, and appreciate your invitation to speak to the group. I am with the National Bone Health Alliance, which is a fairly new public-private partnership, I guess officially launched late last fall. The council is among the members, as well as OWL. We're a little bit of a different group than this in terms of kind of what we're planning to do. Really the goal here is to create it's really an umbrella organization under which our members can develop specific projects. So really we came out of a couple different activities. There was a 2004 Surgeon General's report on osteoporosis that among other things recommended the creation of an alliance like the National Bone Health Alliance. There then was in 2008 a follow-up Bone Health Summit that included about 150 individuals from organizations, government, nonprofits, industry, etc., which reinforced the idea that we needed an alliance. I actually come before the NBHA from the Foundation for the National Institutes of Health. I don't know how much you might know about FNIH, but essentially FNIH was created by an act of Congress to pull together public-private partnerships that include NIH, industry, nonprofits, and other funders. So we really took the model of some of the public-private partnerships that had been launched in the foundation and took it to the National Bone Health Alliance. And actually there's some materials outside that you can see as you're leaving, but we've got about 25 members now. Quite a few pharma companies and other folks from industry, as well as probably almost 30 nonprofits and specialty societies, a few other groups. I think the other thing that's interesting about the Alliance is that we actually have government representatives sitting at the table. So we have NIH, FDA, we're working on a few other government agencies to round out everything. But with really the hope that, for those agencies that don't really have osteoporosis and other bone diseases on their radars, that we can help them get them on the radars by really being exposed to the public health threat that osteoporosis and other bone diseases are. And maybe what I can talk about now are just a few. So we're still a little bit in startup mode, you might say. As I said, we really officially launched last fall. I've been in my job since March as well, so I'm a fairly newbie, pulling together policies and procedures and things around the organizational aspects of the group, as well as our governance structure. But we're already starting to work on a few project ideas, the first of which we're really excited about, which would be pitching to CMS a demonstration project that would utilize fracture liaisons, which essentially are patient navigators. Kaiser and some other closed systems have used these over the last few years and have some really good outcomes, both in terms of saving money as well as improving care for folks once they have that first osteoporotic fracture, to make sure they're getting the diagnosis, treatment, they're actually taking their medications if they're actually put on a medication. So that's the first big project we're working on. We're also talking about a public awareness campaign on bone health, and actually this Saturday we'll be sponsoring a meeting in Atlanta looking at a biological marker bone turnover project that would seek to standardize how 2 of these biomarkers are used by the various laboratories. So we certainly are an open forum for folks that, even for folks that bone health might just be a little sliver of their activities. And certainly we have the National Osteoporosis Foundation, which is actually where MBHA is housed, and the American Society for Bone and Mineral Research, and a number of the other organizations that really bone health or bone research is a big part of their mission. But we are pulling in other groups that have that as a piece. So certainly anyone here at the table that is interested would be glad to talk to you about joining the cause and continuing to move those specific issues forward, as well as looking for ideas around potential projects that our membership can get behind. Because really our goal is to come up with projects that makes more sense to do collectively as opposed to individually. And certainly all the organizations will be doing their own thing as well, but I think especially that CMS project is the perfect project for us to start with, to make sure that we have all the parties at the table.
Can you
Yep.
For those who don't know what
Oh, sure.
the CMS stands for.
Oh, sure, sorry, it's Center for Medicaid Medicare Services. So they actually have, I think it's, how many $1 billion? It's like a $10 billion account, this new Center for Medicaid Medicare Innovation that will be funding pilot projects. And we're hoping that ours is one of them.